Another very lovely morning. My name is Jagana Semakola Ziksoka. Welcome to BBC TV. Good morning, Uganda today. And it is another lovely day that the Lord God has given to us. And of course, just a few minutes ago, I was with Ruben Impima Chibirango in studios here. We talk about sports. I'm a Chelsea supporter. And tonight, of course, we expect to lift the UEFA Super Cup against Villarreal. And of course, the discussion on sports tourism in Africa and of course elsewhere. I talk about the Visit Rwanda mark on Messi's t-shirt or shirt, whatever that is. But I from all that discussion, welcome to our discussion today. And joining me in studios is Mr. Paul Okware, the Chief Stores and Operations Officer from the National Medical Stores, to talk about issues of NMS. You're very welcome, Ndugu Okware.
Thank you very much, Jagenda, for having me here.
I am really very happy to have you here. Thank you so much for joining me. And of course, it is where we are. We just want to get your business right away. Talking about NMS, we normally have a confusion. I don't have a confusion. Ugandans have a confusion between NMS and NDA. How different are you?
Jagenda, we're very different. Although we were born on the same day in 1993 by an act of parliament, our roles are very different. The role of National Medical Stores is basically one of supply chain. We are the quintessential medicine supply chain entity that we have in the country. To understand and appreciate the work that we do, you must have an understanding of what supply chains are. And these are essentially those processes, activities, organizations that facilitate the provision of essential medicines right from the innovators, the manufacturers, down to the individual patients who consume them. Now, to do this, National Medical Stores must be able to identify these items, quantify them, and procure them in anticipation of what shall be demanded. We must be able to store these commodities so that we can supply them without interruption, and then make sure that we have the robust mechanisms in place to make sure that we can distribute them on demand as and when, in the right quantity and the right quality. Our sister agency, on the other hand,
NDA.
National Drug Authority, was put in place to regulate the sector of essential medicines, basically. They have a role to make sure that, first of all, there is availability of medicines in the country, and they've got to make sure that the medicines that we have in the country are safe and they are efficacious. That's just another word for effective. And they do this through the regulation of the sector. So they do regulate the importation, the export, manufacture, and sale of these medicines. And that is how we are different. So we are doing different roles, but there is a very tight relationship between us. So as supply chain entity, as ourselves, we basically are regulated by national drug authorities. So that is how we are able to ensure that the medicines that we are providing for the population are actually safe, by making sure that the regulator is doing their part in making sure that everything we receive, distribute, and even is used is of good quality, and that the regulator has played their part.
How about joint medical stores? Is it called joint medical stores?
Yes. Joint medical stores is a little older than the two of us, NDA and National Medical Stores. It was there much earlier, and it was a time when I think predominantly many of the health facilities in the country were owned and operated by faith-based organizations. And they were doing the role that we kind of do right now. So theirs is also supply chain, but it was specifically for those faith-based facilities. So as government grew and matured, it saw it fit and proper that they have their own agency to serve the public facilities. So we continue to work in the same space. They provide commodities for faith-based facilities, and we do for the public facilities. And even them, they are regulated by
NDA.
Yes, by NDA.
Okay.
So that's how we make sure that everybody has a clear space where they can work. The mandate is clear, and also there is we can have some level of assurance that there is quality medicine being used by Ugandans.
How do you feel when you hear Ugandans say there is not enough medicine in hospitals, and you are those responsible for the supply, as you talk about, and of course the stores itself? How do you feel when Ugandans say there is no medicine in hospital? Because this is a very common talk amongst Ugandans, especially those calling on TV, calling on radio, discussing politicians everywhere. How do you feel when you are supposed to have enough medicines for all of us in the country?
It is disappointing, I think, sometimes a bit frustrating, for some even heartbreaking. because there is a lot of effort that is being put into this system to make sure that we have medicines available for the public. Not only the public sector, but even for the PNFPs like I was speaking about JMS. But you see, there are so many factors that contribute to the availability of medicines within a health facility. One of them, first off, is that if facilities are going to have enough medicines as they will require, there has to be some degree of planning that is accurate. So we normally call this quantification or forecasting of their needs, and we try and support them to see how best they can articulate what they believe will be their future needs and put them down on paper into plans that the warehouses like NMS can then source and provide for them on a regular basis. So that has to be done very well, and we try and support them there. But the other areas also are on the rational use of the medicines. We do have quite a limited amount of funding for medicines, and we need to make sure that we are very judicious in the way we use the resources that we have. We still have a culture of people taking a lot of medicines and using them even inappropriately, self-medication, and even using them for diseases for which they are not indicated. So you have also a lot of misuse and irrational use of the medicines that contributes to sometimes what people may perceive to be a stockout. Sometimes you may actually have physicians actually requesting that patients go get medicine which may not necessarily be required, and they say, oh, that one is not available, so the medicine is not there. Yet there's an alternative which is available that they could have taken at the end of the day. And to tie those two together, we also need to make sure that we have commensurate funding for these medicines here. So over the years, government has been doing, I think, what I believe to be a very good job in increasing the funding available for medicines. Just this financial year, we've seen almost a 49% increase in the budget available for medicines at national medical stores, and it has been gradually increasing. Our partners also, development partners, have also made sure that they support government's efforts in making sure that we have medicines available for them, and they have also stepped up their contribution. So we have a lot of medicines coming through. And when you look at the total throughput that we have in NMS, it is very difficult to understand where we can actually get shortages from. Because I can tell you, just for last financial year, we distributed commodities in excess of 1.3 trillion Uganda shillings worth of medicines to public health facilities. But we sometimes do not see a commensurate decrease in the voices saying that they are not there. So there are other issues further down in the supply chain I think we need to address. Perhaps at the health facilities, we want to know how these medicines are being used, and if the medicines are staying within the health facility and not escaping. And I think that will go a long way in making sure that we can have the medicines available. I think right now we are at a place where we may not necessarily need to put more medicines in directly, but I think control the way they are used and the way they are issued to the patients, so that only those who need them are getting them, and there are no other channels where these commodities may be escaping and going where they ought not to go.
Well, very important. Now, whose discretion is it to decide which medicines are procured into the country?
Procured into the country?
Oh, yes. Whose discretion is that?
The Ministry of Health does have what we call an essential medicines list. So basically, this list describes the medicines which are permitted for use in the country. They also release what they call treatment guidelines. So they'll say, if you have condition X, this is the treatment that you should be getting. So these two married together will give you a combination of the medicines that are permitted for use in the country. And then that is what also the regulator uses to make sure that people who are importing or manufacturing items are actually doing so for products which are approved for use within the country. So there is a relationship there between the Ministry of Health and the regulator to make sure that only safe items are being manufactured or imported or sold or even exported to other countries as well.
Yes, I appreciate that, but I'm also looking at district levels, for example. Who decides what medicines come to a particular district? For example, you are NMS, you do all these, you supply, you procure. And how do we decide and say so much medicine will go to the referral hospital in the regional hospital in Soroti or Masindi or elsewhere and stuff like that? Because at the end of the day, we normally hear NMS again say we need so much hundreds of millions to actually ban the medicines possibly that have expired. And the question would be, money. There are voices saying there are no medicines in hospital, but then the Okwara is actually looking for more money to destroy what we did not use. What causes that?
Okay, I think we need to, I'll answer the first question that you asked about who decides what is actually ordered at a facility level. It is actually the health facilities. Each of the facilities does have a budget and they have an account with National Medical Stores. And against that account or budget they have with us, they place orders and they draw down against that account. So essentially the money that is voted to NMS we just hold in trust. That money is essentially for the health facilities. So we do notify them at the beginning of every financial year that such and such amount is available for you, and we develop procurement plans with them. This is where we try and sit down with them and say, okay, fine, what do you think your needs are for the whole financial year? What type of medicine shall you require? So that we can also go and do the planning on our side, make sure we can have contracts in place so that we can order for these commodities, so that later when they order, they can be available. So to answer the question there, it is the facilities that actually plan for this. All right, from the higher level institutions like Heart Institute and those doing specialized services all the way down to the health center too. They all do plan every year for how they intend or wish to utilize the money that government has provided for them within a financial year. So there are no medicines which show up by mistake. Okay, so that has to be appreciated. The second part of your question is that then how come do we find that sometimes we have instances where some medicines have not been used and they have to be banned. But you need to appreciate one thing here is that many, in fact all of the medicines that we distribute or even we use in the sector are perishable, just like food. And one characteristic of perishable items is that once they reach a date beyond which they do expire. So the science that we are in is that we are trying to see how best we can anticipate what mobility will look like further down the road, and then see how we can make those medicines available for those facilities as and when. But as we provide them, sometimes at the health facility level, you may have morbidity changing from time to time. So you may anticipate I'll get maybe 100 patients of malaria every month, but all of a sudden you get maybe 10. So what happens to the balance? So you have that possibility that you may have some of the commodities going unutilized. But then there's also the reverse. I mean, if I've planned for 10 and I get 20, you end up with a stock out on the other hand. So again, the issue of planning is very critical, and we are basically trying to balance a coin on its side here, because either side of it there is stock out on one side and you have expiries on the other. So the science we're trying to do here is a very delicate balancing act in making sure that our plans match as close as possible to what is actually materialized in the future. We cannot have perfect clairvoyance of what will happen in the future 6 or 7 months down the line, but we try as much as possible to do that. But also in this industry that we are in, it is expected that we shall have some proportion of the medicines actually go to waste. It is not possible to buy all these medicines and have them all swallowed.
All of them, yes, 100%.
Because we buy the medicine, but we're praying we never fall sick. And when we don't fall sick, we actually thank God. But there are the medicines which are already been procured. So it's kind of like an insurance sometimes. So what we try and do here is try and see how we can keep that waste to a small and minimum as possible. So the industry standard for wastage in the pharma sector at least is about 5% of the total throughput that you have. So for every perhaps 100 million shillings worth of commodities I buy and push into the system, I believe that there is a chance that 5% of them, for the mobilities we've identified, may not actually get utilized. So that is the standard we try and follow. But over the years, I think NMS has done a very good job in managing those expiries and the wastage, and we have never exceeded half a percentage. So you can compare 5% with 0.5. So we are, I don't know how many fold, much less, almost, that's a lot, almost 10 times lower than the standard available, which is very good. But nevertheless, when the commodities do get spoiled, we have to find ways of making sure they do not get relabeled and and then also disposed into the environment wrongly. We have to make sure that we find proper and fit ways of making sure we can dispose them safely for the environment and for the people as well. So
well, very important. Now back to the COVID fight here. We know that the way to go now is we're looking for vaccines, and The explanations that we got for, first of all, having AstraZeneca in this country was because of, one, the costing itself, but secondly, its storage capacities.
Yeah.
And I want to know from you, because expert analysis says the other vaccines, Pfizer, Moderna, J&J, and quite a number, they require different storage facilities. Do we have them here? Because we're now moving into finding vaccines from every arm. We can't say we rely on only AstraZeneca. We're now getting all the others. Does NMS now have the capacity to store the other vaccines? If we got Pfizer into the country, Moderna, AstraZeneca, Sinovac, and all these others.
Yeah, I think the decision at the beginning of the pandemic to actually go with AstraZeneca, I think, was well informed. You have to play to your strength in this business. You do not play to areas where you do not have that amount of strength. And our strength has been in vaccines, which we have been holding at 2 to 8 for the greater period. We also have capacity where we store vaccines up to -30 and even up to -85. National Medical Stores holds Ebola vaccine, which goes all the way down to -85. And we have been storing this for quite some years now. But this capacity is limited. And when you're looking at a program here where you want to have vaccines for more than 22 million Ugandans, you have to use the most readily available, and also not just the system that is available at the center, but also one that is available at the districts and the health facilities. So the best fit in this scenario in terms of price, temperature range, capacity at the districts, capacity at the health facilities, and also the training of the health facilities in how to administer vaccines at 2 to 8 was the AstraZeneca. But given that the global pandemic is not necessarily slowing down, we're seeing that with the variants coming along now, like with the Delta, which we're seeing in many parts of the world, there is a very, very sharp increase in the demand for the vaccine, and there is difficulty in sourcing it. So we have to widen our perspective a little bit and not just look only at the AstraZeneca that may be available, but look at other options. So to do this, we're working very closely with our partners, UNICEF and even with USAID. We're trying to see how we can get some additional ultra cold chain capacity in the country, and that will be in by the end of the month. We believe we should be able to hold more than 3 million doses of the ultra cold, like the Pfizer vaccine that will be coming through. And I think that will give us a lot of comfort that now we can look at other options if the AstraZeneca is not forthcoming. But also to give the public comfort, even our current capacity, even just for the vaccine which can be held at 2 to 8 is close to about 5 million doses we can hold. And that is about 10% of our capacity right now.
5 million doses?
5 million doses we can hold. And that is about a tenth of our capacity. So we have kept the other capacity for the routine vaccines that we are distributing, the measles and the rest of them. And we've earmarked at least a tenth of our capacity for COVID, which can hold up to 5 million doses. So the plan is never really to hold up to 5 million. We always want to bring in just enough to vaccinate and then have replenishment. But that is the scale of the capacity we have, at least at the Central Medical Store, which is National Medical Stores. And we have commensurate capacity as well to distribute that volume within one day as well. So if push came to shove and we needed to have 5 million out, if we had it in the warehouse, we also have the capacity to move it. We have a fantastic fleet of cold chain trucks, and these are able to transport these vaccines across the country, and we can have this dispatched in a day.
Okay, well, very important. The last time we had the Minister of Health here in studios, she was asked a question over how to get the public or the private sector to also help in procuring the vaccines from where they can. You talked about the private sector players, especially the religious entities. We think and we know that these have connections they can get this elsewhere. And the Minister in her response said, I think they're supposed to go through NMS if anybody came through. I just want to know whether you have any who have come to you and what that means, what that simply means. Does the private sector come with money to you? What do they come to you with at NMS? Because we know, yes, you are responsible for all that, the procurement, the storage and you know, movement and stuff like that. Have you had any, and what needs to be done by the private players, churches, religious organizations and all those others that could be having connections that can help us get the vaccines into the country?
Okay, very good. So I think what we are recognizing here first from what the Minister is saying is that the best remedy we have for this pandemic is vaccination. And I think we must get as many people vaccinated as possible as quickly as possible. It's the most cost-effective way of managing the pandemic. And we have broadened our options of how we can get the vaccine in. We are also exploring to see if there are private entities who have the means and mechanisms and financing to get the vaccine into the country and to make sure that we can get as much as we need. We need all the help that we can get. Now, on the logistics of how the vaccine gets into the country and then is distributed where it's going to be used, I think the guidance we're getting from the ministry, I think, which is also very well informed, is that it is better to have a central repository for this vaccine as it comes into the country. One where we know we have the capacity, one where we know we have world-class experience in managing of vaccines for several years, and then we can be able to monitor the quantities that are coming in, the quality of the vaccines that are coming in, and how they are being distributed across the country. It would be very, very risky for us in our particular setting to have multiple warehouses holding the vaccine. There are so many interests in the vaccine, and we doubt if they would have the adequate security, technology, knowledge, the total wherewithal to be able to manage these vaccines and make sure that they are properly stored, transported, and even in case we need even reverse logistics, that executed well enough. So to give the country comfort, it is important that government takes on this role and make sure that we hold this vaccine, and as and when they require it, we can have it distributed. I think it is smart. It's not a ploy for NMS to make some extra money, but I think it's in the general interest of the public that the most competent agency in managing of cold chain actually manages the cold chain.
Okay.
Yes.
In this fight of COVID-19, we have seen or realized that we need lots of PPEs, essential medicines, and of course all these others. And I just want to know how you as NMS determine the allocation of all these PPEs and essential medicines. What do you look at in determination of what goes where and how?
Well, Jagenda, this COVID-19 response has been one truly, I would say, national effort. We have seen inter-sectoral coordination. We have seen also interagency collaboration, and that is what is required to be able to overcome this pandemic. So to appreciate how NMS is working to make sure that these are provided, at the top level there we have the task force being coordinated by the OPM, and within the health space you have the ministry taking the lead in making sure that they can manage at least the health aspects of the pandemic. So they've set up what we call an incident management team with several pillars inside there that are supposed to support the response. One of those key pillars is logistics, that is chaired by National Medical Stores. And our role there basically is to make sure we identify the PPEs that are required, quantify them, coordinate with the different agencies, because we have so many agencies that are playing a role in this fight against COVID. It's not only government and National Medical Stores. We're getting support coming in from UNICEF, from WHO, from WFP, UNHCR. So many private players are coming in to provide support, and we don't want people to bring items that are not required or bring items when they're not required. In a response like this, you want to make sure that you put all your resources to best use. You don't want to use the precious resources you have and deploy them where you will not get a return on that investment. So the role here of logistics in the Ministry of Health is to make sure that we can coordinate this response. So this very same committee in the Ministry of Health, which again is chaired by NMS, receive requests from different facilities. They appraise those requests and see the adequacy of those requests. Do they cover IPC? Do they cover care and treatment for the patients who are going to be there? Are they in line with the policies that we have, that the ministry has set out for protection of health workers and for treatment of patients? And then that informed decision is an instruction that is sent to National Medical Stores, is sent maybe to WHO or UNICEF or any other agency that is supporting the response. So there is a lot of interagency coordination at the level of the Ministry of Health, and also NMS is taking part in that. So we are reliant on the decisions of that technical team in the Ministry of Health to determine what is most appropriate to send where. So that will be informed in a big way by surveillance data. We want to know where are the most patients, where is the disease most prevalent, and also where we're having the most risk in terms of the numbers of of healthcare workers at the different levels of care. So all these things come together very well, and that is how we determine what quantities are going to be done. So when those instructions later come to NMS, then we do the needful and make sure we can fill those orders as quickly as possible and see if we can provide our frontline workers at least with the resources they need to be able to mount a reasonable response to this pandemic.
Very good.
Yeah.
So how has COVID itself affected your routine supplies of medicines across the country? Because we've been with COVID here for now, it's coming to 2 years, close to, and things have changed and been affected grossly. We just need to know, because you are still in this business and you still have to operate. But how has it affected your routine supplies and your operations in as far as medicines?
Our primary business is the routine distribution of essential medicines, but also we have a responsibility to respond to public health emergencies. We've done so before for Ebola, Marburg, cholera, and the outbreaks that come about, but those have normally been small, and we have found it within our means to be able to do this work. COVID has presented itself in a very different way. This is sustained for a very long period. We're into a second year. We don't think it will end this year. And also the scale of volumes of medicines that we have to move out have actually been quite tremendous. And it's not affecting isolated pockets across the country or the globe. It's just basically everywhere. So logistically, it presents a very unique challenge for us. I think one that we have not experienced before, and even I don't think any other agency has experienced somewhere before. So initially, at the start of the pandemic, we did see a lot of disruptions on the supply side, where you had materials coming in a more organized way. COVID is causing so many disruptions, where you take you probably a month or two to get an item, now it's going to take you a little bit longer. And very, very fortunately, I would say we had been working very closely with the ministry on the development of a medical countermeasures plan. Medical countermeasures are those equipment, PPEs that we use in emergency responses. So we were at least having the framework at the back of our minds of how we thought the country should be able to respond to a public health emergency of this kind. So there were disruptions upstream, definitely, but also as an organization, we are not immune to the effects of COVID. We saw the government put in place restrictions on movement, and some of our staff do live far away. So access to work also becomes a little bit of a challenge. Working hours had to be reduced because it would not be very easy to work at night. So you are under pressure to do the routine, and then also have the surge operation to make sure you can provide over and above. And I think we adapted very quickly to make sure we had that. We got, I think we're deploying more than 4,000 square meters of space additional just to manage the COVID supplies that we had. We had to get some extra personnel to make sure that that function in the entity also works well. And then also find very clever ways of making sure our staff can be available to work without the risk of them getting infected. Because if we said have infections within the organization, would be very, very difficult. So again, yes, it was a challenge, but I think we have continued to provide the medicines on routine basis. And the buffers that we have held in our warehouse have allowed us to ride the supply disruptions that we have seen. And I think very good justification in making sure that government continues to operate Central Medical Store and maintain control of such key life-saving commodities.
We've also had instances where we've seen drugs moving from public hospitals to private clinics, to private hospitals, private facilities of Ugandas and the quarries of this world. And we keep wondering, when you as national medical stores take medicines, for example, from the central medical stores to a facility in Arua, in Soroti and elsewhere, do you follow up to actually know what happens? Or when you take them to the facility, store them there, and then you move away? Because the other day we see people running with that. And I just want to know the prevalence of that and how much you are typically doing to save this country and to save us from public medicines that go into hospitals and nicked into private facilities.
Jagenda, I think that is a challenge that I think we are all becoming very alive to. And I think even with the goings on with COVID, this has come more to light now that the health sector, I think, is getting a little bit more prominence, I think, in the news. Stories related to medicines, I think, are of interest right now. But I think there is a certain section of Ugandans, as someone put one time, who are yet to be baptized, who still see it fit and proper to take commodities which have been provided to a health facility at no charge and take them out and see if they can profiteer off of it. It is something that we know to be happening, and we're working very hard to stop it. But from the side of NMS, there's a bit of a challenge, and because our mandate is clearly for the procurement, storage, and distribution of essential medicines. Our clients are the health facilities. Those health facilities have accounting officers, and they have mechanisms within there to make sure that the medicines or resources that we have given them are appropriately used
there and, of course,
and accounted for. So it's very difficult to overreach and go in there and try and do some of these things. But we do get the reports, and over the years we have chosen to start working with some strategic partners. So from time to time you will hear that the Health Monitoring Unit has been able to identify some people who have been taking these commodities. So those are people we have been working with for a very long time to make sure that we can identify those people who are moving those products out of the public system and perhaps trying to profiteer off of them. We've also been working a lot with the CID to make sure that we can also prosecute them, so that at least we can set an example. That if you take medicines meant for people of this country, and government has already paid for them, and paid for them through taxpayers' money. So you can't ask people to pay twice, pay the tax and then pay for the medicine. That is very unfair, and it's normally the people who are most in need who are actually taken advantage of. It is completely unacceptable, and it's something we're working very hard to make sure that we can address. But also to support those agencies who are trying to nip the bud there and make sure that we don't have any proliferation of these commodities outside the public sector supply chain. We went ahead and we have conspicuously marked all our medicines that we procure using GOU money. So you will see very clear labeling, Government of Uganda, not for sale. So the simple thing there is that if somebody is caught with these commodities,
and the expectation is that Jagger will be so patriotic to look at this and say, this is Government of Uganda.
Yes,
don't
please.
sell it to me.
Exactly, exactly.
But a desperate Jagger will just say, then you know, and it's written on labeled Government of Uganda, not for sale.
You should not pay for it. And whoever is trying to sell it to you, Jagenda, you should actually find a way of making sure that you notify the local authorities, because that is how we start clamping down on this. And it is one of the reasons that you were asking me in the first place that the medicines are not there, because so much is being provided. We have so many disease programs which are fully funded, where we actually bring in more than the actual cases or that are actually reported, and you wonder where does the medicine go sometimes. So it's some of these areas here I think we need to all be aware. I think perhaps as we live through COVID, people are being more health conscious, and I think that is very important for all of us. So people will take note herein and know that all these medicines marked like this are actually provided for free. And I think we shall start seeing people being more demanding for services at those points of care, and not just accept that they ought to pay for medicines which they have already paid for through taxation.
Do you as NMS do some impromptu visits to health facilities to actually find out and ascertain whether medicines are in hospitals? For example, when you deliver medicines to a particular facility, a government facility anywhere, do you do those impromptu visits to actually just find out? I tried it out myself when I went to UCI, the Cancer Institute, and I just wanted to go there and find out. And they gave me a whole list of medicines, and there was just one particular medicine that wasn't with them. And they told me, well, these are about 47 medicines here, but if Okware comes here and he wants specifically this number 41 and it's not here, Okware can go trade and say there's no medicine in hospital. I went there, but there's no medicine. And now that's another thing. But you do those impromptu visits to actually find out. And secondly, is it surprising when somebody writes to you, one DHO writes and says, you gave us medicines, Coatem or so, whatever it is, but it's out of stock now, before the next supply comes in? Does it surprise you that they've outused all the medicines in a period of time? Is it surprising that people got sick and they consumed all these medicines?
Again, it's quite shocking. Sometimes we've actually gotten reports like that. You make a supply which is reasonable, and there is no indication.
And you expect it to run for maybe whole year?
Absolutely, absolutely. And within a very short period, you find that it has actually been exhausted. But in those instances, we've always had our ears on the ground, because we have a whole department that interfaces with our clients. And they try to make sure that they keep in touch with them, appreciate their morbidity in those areas there and their consumption patterns. So when we get anomalies like this, we normally investigate. But sometimes you even get more arousing information. But we can't go there as ourselves, as NMS. We normally try and work with the police if we believe there has been foul play. So that is normally what we do. Quarry can't go and arrest somebody. I am not a police officer at all, and I shouldn't be doing that. So what we do is we go to the relevant authority, the police, and we tell them that we suspect that there is foul play here, and let's go have another look. And very often we do find that our fears are actually on the ground, and we've been able to apprehend a few individuals. But again, this is only a symptom of something much deeper. And I think we can't be everywhere. We can't pick up every hint that medicines have been pilfered, and that is why we try as much as possible to put the messaging out there that government is providing commodities free of charge. So if you go into a public facility, please demand that it be provided for free. And we can start from there. And I think we can find that we can cover a lot of the need in the country in terms of what is required for the provision of essential medicines and health supplies.
One of those last questions from you, from me to you is, let's talk about the space itself. How much space do you have at Entebbe, and how much space do you also have at the different facilities where you drop these medicines? Do you have sufficient space for storage in regional hospitals, for example, in the other public hospitals? Do we have enough space to keep the medicines, or we're also grappling with that challenge?
No, at national medical stores, for example, we discussed cold chain. I told you that we have appropriate space. We also just in the final stages of completing a brand new warehouse in Kajansi. It's going to give us about 3-4 times the amount of space that we have. So if you look at cold chain, for example, our capacity at Entebbe is about 800 cubic meters. In Kajansi, it's going to be about 4,000 plus. So you can see that's several folds more.
More than what it is.
So we're planning for the future. We believe it will help us cover the mid-term, but even the ultimate long-term. Even in terms of the actual space we have on the floor, we are finding that we have approximately 12,500 pallet locations available to us in Entebbe, and when we go to Kajansi, we will be adding on an additional 30,000. So you can see we're not just looking to cover the needs that we have right now, but we're also trying to cover the needs for the future. But our operation is scalable, and that's what logistics and operation is all about. So if there is a need for the space, we scale it to match that need. But the smart thing we try to do is not just to have as much space, because that becomes very expensive. And if we're expensive, the amount of money available for medicines goes down. So we try and be as efficient as possible. So we try and see how we can be clever in the way we schedule deliveries from our suppliers, and how we can schedule deliveries also for our clients on the other side. On the side of the facilities, I think we still have a bit of a challenge, I think. Many of them have good space, some still do not. For the larger facilities like the regional referrals, the volumes and the budget they have, I think means that they cannot take stock for 2 months, so we give them every month. So that works out easily. So you solve a space problem just by scheduling the commodities to go there a little bit more frequently. But that's like for the larger ones like Mulago and those. So the smaller ones, if they can take commodities which they can take in 2 months, we schedule it that way. So we try and use some logic in the way we provide the commodities to make sure that space as a problem is negated.
Okay. Well, I want to thank you so much, Mr. Okware. Your final message from your heart in just 1 minute to the public.
Okay. Thank you very much, Jagenda. I think what can I say? We are distributing vaccines.
Sure.
Just on Monday we distributed all the vaccines that we had available, and these are now available in the districts across the country. I think my message is that if you're eligible, please go get vaccinated. I mean, it's the cheapest and safest way we can protect ourselves and our loved ones.
I want to thank you so much, Mr. Paul Okware, the Chief Stores and Operations Officer from the National Medical Stores. Thank you so much for having allowed to join us this morning here on Good Morning Uganda Extra. And I think when we find time next time again, please we'll call on you and come back and talk to us, because we need to hear loads and more from you and from the central stores there. Thank you very much. When you go back, send my greetings to Ndugu Kamavari, my very good friend here. I remember one quotation from him when I hosted him in studios here. He said, "You have no right to demand for coatem if you deliberately refuse to sleep under a mosquito net. If government gives you a mosquito net and you say you will not sleep under it, you have no right to actually say, I need my coatem."
Absolutely,
yes,
absolutely. I think we're we're very good at
we give a
advocating
net
for...
to save the quantum. So when you say don't need the net because it gives me all this warmth and all stuff like that, then you have no right to say mumpeko watemo wange.
Yes.
Well, to Ndugu Kamavare, thank you so much, and of course, thank you so much, Ndugu Kware here. My name is Jagana Semakola. I stop it here for tonight, and of course, wishing all the best for tonight. Charles Odongtho will be coming on with Behind the Headlines, but of course, Chelsea is also playing against Villarreal. Forgot on my cap. Good morning.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.
Every man